Hi, my name is Dr. Jennifer G. We're here today to talk about lumbar canal stenosis and the causes, the treatments, and what to do when you have lumbar canal stenosis. So basically what lumbar canal stenosis is basically just narrowing of your spine. The most common types of lumbar canal stenosis is number one in our central canal. This is where the spinal cord ends at around L1, L2, and the nerves actually continue all the way to our spine and sacrum. The second type of lumbar canal stenosis that can occur is when the nerve actually exits their exit. These holes, which we call in medical terms foramen, can actually get stenosed, basically meaning that they get narrowed. And why this usually occurs is in our 50s, 60s, and 70s, what happens is we have vertebrae here, which are the bones in our back, and in between the vertebrae we have something called disc. And basically the disc acts as our basically our cushion to allow for movement. And basically these cushions, as we get older, they dry up, causing a loss of disc height. And as we lose disc height as we get older, there's also hypertrophy, which is basically our joints in our back also gets arthritic, and what happens, they get bigger. So can you imagine if your disc height decreases and your joints actually get bigger, they can cause narrowing of these keyholes that are in our back, causing lumbar canal stenosis. So how does lumbar canal stenosis present? You usually see it, like I said, in your 50s, 60s, and 70s. Patients typically have low back pain and it radiates down to their legs. And basically their main complaint is, hey doc, I can only walk for a few blocks, and then the pain starts. So the best treatment for lumbar canal stenosis is basically physical therapy. We want to basically strengthen all the muscles in our back and strengthen our abdominal muscles. We want to do flexion-based exercises, because as we lean forward, it actually opens all our foramen in our back. And that's why a lot of elderly people think that they have bad posture, but actually that posture actually helps their low back pain. The second thing we can offer is obvious medications like anti-inflammatories to decrease the inflammation of the nerves and the muscles. The third thing we can offer is actually epidural steroid injections. We could do two types of injections. We could do intralaminar, which is directly into the back, or more specifically, depending on where your stenosis is, at which level, we could actually do transforaminal epidural injections, where we could basically just target the level that's involved. And and obviously our last option is to possibly do surgery, where we could do a laminectomy, where we can open a window up in our spine, creating more room for those nerves to breathe and heal. Thank you again for listening to the causes and effects and treatments of lumbar canal stenosis. If you have any questions, you can contact us at Centers for Integrated Pain Treatment. Our number is 201-941. What is it?
1353.
1353.